What if a painless and devoid of side effect injection of a portion of a person's own blood was able to revert back time by years and decades? Human blood contains anywhere from 37 to about 45% red blood cells. About 1 to 1.5% of the blood are white blood cells, which are immune cells. The rest is what's called plasma, which is the liquid that these cells float in. We also have these cell fragments of a cell in our bone marrow called platelets, which float in the blood in case a capillary is severed. In addition to red and white blood cells and platelets, the plasma contains components of fibrin. These protein molecules called fibrin, they coagulate together and they form a Swiss cheese material called fibrin. And platelets, they get stuck inside the holes of the fibrin or even induce the fibrin formation. And lo and behold, we have a blood clot stopping the leakage of blood from the severed capillary, say from a shaving neck. Now, on the other side of the blood clot, invariably the body needs regrowth and regeneration. Platelets contain these regenerative factors. Platelet-rich plasma involves employing these molecules that are inside the platelets. Normally, platelets float in our blood for about 7 days, and then they are decomposed, or our liver just gets rid of them and turns the proteins into amino acids to be regenerated again. In platelet-rich plasma, we concentrate and inject the platelets into the tissue in which we need regrowth and regeneration. In the case of the genitalia, say a man's genitalia is already gets already full of blood. So how come our own blood doesn't induce regeneration and improvement of it? Well, the platelets aren't activated. They're not burst to release their contents. In platelet-rich plasma, the treatment of the genitals in men and women, we activate the platelets to induce them release their contents to allow these molecules to do their job. Hello, I'm Dr. Jack Silvers, the dermatologist at Brentwood Dermatology in West Los Angeles. In this video, I'd like to present a short clip of the sounds in an exam room where I injected the genitals of a middle-aged man to help him lead a happier, more fulfilling, enjoyable life. I remember in my medical school interview in September of 1988, Dr. Bob Marion asked me in my interview, why do I want to become a doctor? I told him that I'd like to help people. Later, in my medical rotations in third and fourth year of medical school, I realized that I really like to help people who have a functioning brain and have a life ahead of them. That's what I really enjoy. Injection of platelet-rich plasma has brought my wishes true. It's a great tool that I use for many different reasons, whether to help a man or a person grow more hair or thicker hair on the scalp, or have facial rejuvenation or breast improvement. And it's been most successful in reverting the genitals to be how they used to be years and decades before in men and women. As you'll see in this, you'll hear in this video, after applying numbing gel, the patient was fully numb and barely felt anything, and it's quite tolerable. you're more than welcome to watch the full video, and I invite you to come over to my office to watch the full video, and I'll go over the procedure and explain any questions you may have. It involves drawing a little bit of the patient's blood and extracting the platelets, in a way concentrating them, and injecting it back into the tissue, in this case the genitals, to have both sensation and functional improvement. And it reverts the function and the sensation back years and decades after just one treatment. Amazingly, in women, they can expect a greater pleasure, and apparently 2/3 of women have some urinary incontinence, whether they've even given birth to a child or not. And this tightens the tissue and brings it back to how it used to be, and reverses or at least diminishes the urinary incontinence, if not completely obliterated. Here is the clip I promised you, and hope to see you at my office to meet and explain about this. Great. So it was injected. There is barely any swelling at the tip here, okay? Tolerable?
Yeah, it's okay.
But you felt the initial shot?
No.
You might ask, why would you want to ask a dermatologist, a skin doctor, to perform this procedure? Well, I inject platelet-rich plasma pretty much every day in different areas of the body. As a dermatologist, I am very competent and aware of the interaction of a needle and different tissues. I have a great feel for it, so to speak, how a tissue would interact with a needle, at what level I am, how much to inject and how to inject, and what reactions to expect from the tissue that's injected. 1/3 of my residency in dermatology involved dermatopathology, essentially looking at different skin and tumors and tissues under the microscope. That's in addition to what I learned in medical school. So I feel I would be a great specialist to offer this procedure. I invite you to give it a try, or let your friends and family know, so that they could have and lead a better, happier, healthier, and more enjoyable life. Thank you for watching.
Thank you for watching our video. If you have any questions, please call us at 310-826-2051 or visit us at brentwooddermatology.com.